with a hope their medical problem is going to get resolved. When we keep talking about industry, what we completely forget, this industry is all about fulfilling the hope of Hippocrates, the father of medicines, who treated the patient with kindliness, care, and concern. And he made a very one-liner where we all sign up to, many of us in the doctor profession, that do no harm to patient. That is the fundamental belief of OPPI in driving the agenda for the future in the area of healthcare. I had a chance many times to experience what hope means. I was in the OT in Tata Memorial Hospital. There was a linear anterior resection that was happening, and patient was being wheeled out, and the relatives are waiting outside, anxiously waiting. What happens to my dad? And you realize how much of joy that comes out of the hope. And the same thing when I see a patient waiting outside the clinic, speaking to an endocrinologist, and this patient is going to get amputated because of gangrene, but the patient doesn't know that he is going to get gangrene. So very important for all of us to know that our business is the business of fulfilling the hope. As far as OPPI is concerned, we have 3 pillars. Primarily, how do we empower the patient? And first and foremost, we all think that we are just producing pill. Pill is just not a pill. Every company in OPPI member companies do so much, right from the raw material that goes into the pill, right from the time when the pill leaves the warehouse in the hands of the patients. There's so much that happens. And we are so committed to making sure the bioavailability of the drug delivers the promise and fulfills the hope of the doctor who said that this drug will help you to recover from the disease. So the pill is just not a pill. It's just beyond what we do with the pill. Second and very important is the innovation, as you all seen in the audio visual. There are many patients who are waiting. When is my breast cancer are going to get cured? When is my leukemia is going to get cured? When is the cure for artificial pancreas? There are a lot of questions that are being asked because they can live longer, and there's a big hope. Innovation is such a crucial element of OPPI's commitment. And we are committed to making sure that innovation happens just not on a worldly basis, but can we figure out how to treat dengue in India? How do we resolve the problem of infertility in India? How do we treat specific problem related to Indian population? So we are committed to working with Government of India in making innovation happen, and there are various discussions are happening at various stages. Very important aspect of Health Meets Hope. We want to make every doctor makes a responsible choice. The responsible choice happens because of transfer of knowledge, not because of transfer of any other value. So we are so committed to having good practices, of ethical practices, which Kanchana talked about, and day in and day out, we have set up people who are compliant and making sure the ethical practice comes into play. And last but not the least, the robust guidelines for OTC. There are enough reasons that we need to empower the patient so that every drug need not be consulted with the doctor. So we, along with the ministry, working towards creating a OTC guidelines. Ladies and gentlemen, this day is all about deliberation of Health Meets Hope. There are millions of patients waiting outside. what are we doing here? And that's why if you look at the lineup of the conversation that you're going to see in today's deliberation, it's all about how you're going to make the patients in India's lives better and enjoy every bit of the livelihood, whether it's young or old. With that, I look forward to a wonderful deliberation and an outcomes will be published, and we'll prepare a white paper where there will be an actionable points that will make sure that happens, which will fulfill the joys of life. Thank you very much.